Let's speak now with Dr. Perry Wilson, Associate Professor of Medicine at Yale University School of Medicine. Doctor, welcome to you. Alisyn, every time we do a mask mandate lifting story, I think about that time we were together. It was May of 2021. The CDC said, take off your mask if you're vaccinated. And then came Delta. And then came Omicron.
And we put the mask right back on.
And we put it right back on. Doctor, is it time for these mandates to be lifted considering what we're seeing?
Well, we are seeing a downtrend in cases almost all across the country. And the thing about Omicron being so infectious is that a lot of people were infected. It's very likely that cases will continue to decline simply because the virus doesn't have that many new places to go. Do we know masks are effective at preventing transmission? Yeah, there's new data coming out even just recently by CDC suggesting that people who are wearing masks are less likely to become infected. So on an individual level, absolutely, it will protect you. If you feel safer wearing a mask, go ahead. But I think the writing is on the wall here. As case rates start to go down, there's going to be a lot of pressure to pull back on those mask mandates. I don't think that's going to change very much, regardless of what public health experts might advise.
I am so interested in this national wastewater study, and words I never thought I'd say, but that there's this national wastewater surveillance system, and it monitors wastewater in 19 different states. 2/3 of the sites, I think it has something like 500 sites, 2/3 of them have shown that any traces of the virus have gone down in wastewater. And so does that mean that COVID is over or Omicron is over? I mean, I really want to brace myself and not think that, okay, the light at the end of the tunnel, we are almost out of this, if that's not true.
Well, so we've been using wastewater sampling here in Connecticut for almost the entire pandemic, and so we have a lot of experience with it. It is a leading indicator of cases. So the rates of coronavirus in the wastewater goes up before the cases start coming to attention in the hospital or in the clinics outside. Really interesting. And the reverse is true too. Those levels start going down even before the case levels start going down in the local area. So it's a really great indicator of what's going to happen. And the truth is, cases are going to continue to decline. That is what's going to happen. What I can't tell you is if they will decline down to such a level that, we are effectively can declare the pandemic over. As we've seen many, many times, cases can go down and then they can come back up. I think a lot of us think that because Omicron was so infectious, we won't see a rebound infection wave after this because of the spread of immunity through the population. But I've learned enough not to make predictions. In the short term, cases going down, that's as far as I can go.
All right, let's talk about the Moderna approval. Still needs the CDC director's sign off, but the CDC panel has approved it, the FDA as well. What's the significance of this approval considering Pfizer's been approved for some time now?
Well, what has happened here is the CDC has gone from their interim approval, which went to, or interim recommendation, which went with that emergency authorization, to their full recommendation. And what they've done in between times is had access to all the new data that's come out since the interim recommendation, particularly a lot of safety data regarding things like myocarditis, heart inflammation from these vaccines. So they had access to all that data and can say now, in the full light of day, that now that we've given millions and millions of doses, what is the true risk versus benefit? And it was very clear. Myocarditis rates were inflated, but even in the highest risk group, young men, the rate was about 60 extra cases of myocarditis per million injections. That was not enough of a safety signal to outweigh the dramatic benefit, which in that same age group is about 1,000 fewer hospitalizations. And so the panel unanimously endorsed this vaccine, which I think makes a lot of sense.
One last thing, doctor. The deaths are still staggeringly high. We don't talk about it that often anymore because we hope that we're coming out of it, but 2,441 Americans a day. That is the average this week. I mean, that's just a number that it would have been inconceivable, obviously, before the pandemic to imagine something like that. And they seem to be, and here's the graph, they're still very, very high. How long is that going to stay?
Yeah, and let me put that number into even more perspective. In a bad flu season, if we take all the deaths in a bad flu season, we see about 100 per day if you kind of stretch it over the course of a year. Okay, so this is, even right now, we're 24 times worse than what you might see in the bad flu season. It is horrific. We know that deaths lag behind cases by about 4 to 6 weeks. That's been consistent throughout the entire pandemic. So we really should see deaths start to decline because cases have been declining for some time now. We'll see it earliest in the Northeast, where the Omicron wave hit first, and then it'll sort of, that decline in death rates will spread across the country, mirroring that Omicron spread from 4 to 6 weeks ago. So that should happen, but the number is still very high, and we're a long way to get to 100 deaths a day, which we might consider normal of a typical respiratory virus.
All right, Dr. Perry Wilson, thanks so much.